Herein, we report a surgical technique for arthroscopic suture anchor repair with a modified Mason-Allen technique for medial meniscus posterior root tear. There are no conflicts of interest. The procedure is performed under general anesthesia in the supine position. In this video, the technique is performed on the left knee. The knee is positioned at a 90 degrees angle, with the ability to lower it down. Perfusion is performed using a pump and the perfusion pressure is set higher than usual to facilitate posterior manipulation. First, the anterolateral and anteromedial portals are created, and the MMPRT is identified. The residual tissue at the MMPRT attachment site is debrided and the cartilage is removed using a curette. The synovium at the portal side is resected to create a far anteromedial portal. The meniscotibial ligament is then detached. The posteromedial area is observed in the transcondylar view, and a posteromedial portal is created. The portal creation site is determined using a 23-gauge needle. After making an incision with a scalpel, it is widened with a Kocher clamp. The portal is made higher than usual to facilitate anchored insertion. Next, a curved guide is inserted through the posteromedial portal. The site of cartilage removal is used as a landmark. After placing the guide tip at the insertion site, it is stabilized using light tapping. Drilling is performed using a guide. An Iconix anchor is inserted through the guide. After the anchor is firmly inserted, it is pulled to confirm that it is secure. We then proceed to the modified Mason-Allen technique. The anchor used in this technique has two sutures, one white blue and one blue. First, one strand of the white blue suture is passed through the meniscus. Both ends of the blue suture are once passed through the anteromedial portal and moved to the anterolateral portal to facilitate the procedure. One strand of the white blue suture is then passed through the anteromedial portal and loaded onto the first spas. Using first spas, the white blue suture is passed through the meniscus for 2-6 mm inside and slightly posterior to the MMPRT end. The suture is then passed through the far anteromedial portal to facilitate subsequent steps. A vertical suture is created as a blocking suture. One strand of blue suture is passed through the meniscus. Using first spas, the blue suture is passed slightly outside and posterior to the white blue suture. The suture is then passed through the far anteromedial portal. A second blue suture is passed through the meniscus. The remaining blue suture in the anterolateral portal is moved to the anteromedial portal and passed through the meniscus similarly but slightly more anteriorly than the first. Both the blue sutures that pass through the meniscus are removed through the anteromedial portal. The ends of the blue sutures passing through the meniscus are tied to create a vertical suture. Using a knot pusher, the meniscus is pressed against the attachment site, and 3 to 4 single knots are tied. Excess sutures are removed using a cutter. At this point, the meniscal tearend is brought closer to the attachment site and fixed. The remaining white-blue sutures in the posteromedial and far anteromedial portals are moved simultaneously to the anteromedial portal. Sliding knot suturing is performed using a white-blue suture. The non-meniscus past end is used as the post and shorten. A sliding knot suture is applied, guiding it to cross the blue vertical suture. The white-blue suture crosses the blue suture in a crisscross manner. Additional 3 to 4 sutures are tied and excess sutures are cut. The tear end is further approximated to the attachment site and securely fixed. Although deep flexion is not performed, stability is confirmed within a range of motion extension of 0 degree and flexion of 120 degrees.